Hey everyone! Imagine needing a life-saving stem cell transplant, but instead of going through brutal chemotherapy or radiation, you get a single IV treatment. And that's it. Sounds like science fiction, right? Well, thanks to some amazing work at Stanford Medicine, it's now a reality for kids with a rare genetic disease called Fanconi anemia. So what's Fanconi anemia? It's a genetic condition that messes with your DNA repair system. Over time, your bone marrow, which makes blood, just stops working. Kids with this disease get tired easily, don't grow as well, and are constantly at risk for infections and bleeding. And by age 12, most of them start to experience bone marrow failure. Traditional treatments, they're intense. Chemo and radiation are so toxic for these patients, they can actually do more harm than good, leading to severe side effects and even cancer later in life. But here's where it gets exciting. Stanford researchers have developed a groundbreaking new approach. Instead of chemo or radiation, they use an antibody called briquilimab that targets a protein called CD117 on blood stem cells. Think of it like a heat-seeking missile that wipes out old faulty stem cells and clears the way for healthy donor cells, without all the collateral damage. Let me tell you about Ryder Baker, an 11-year-old from Texas. Before this new treatment, Ryder was tired all the time, couldn't keep up with other kids, and was always getting sick. In early 2022, he became the world's first Fanconi anemia patient to try this new antibody treatment. Fast forward 2 years, Ryder is now playing pickleball and soccer, growing taller, gaining weight, and barely ever gets sick. Imagine going from zero energy to living your best kid life, just because science found a better way. The trial started with 3 kids, all under 10, each got a single infusion of briquilimab 12 days before their transplant, plus a few standard immune-suppressing drugs. No chemo, no radiation, and the donor cells? They came from a parent after removing certain T cells that can cause complications. The results? They were aiming for just 1% donor cells in the patient's marrow. They ended up with nearly 100%. 2 years later, every single one of those kids is thriving. And it gets better. This method opens doors for more patients. By making it safe to use half-matched donors, almost every child who needs a transplant can get one, even if they don't have a perfect donor match in the family. Right now, Stanford is running a phase 2 trial to help more kids. They're also looking at other diseases, and maybe even using this for older or more fragile cancer patients in the future. So, with a little antibody magic, toxic chemo and radiation might become a thing of the past for some of the most vulnerable patients. That's a revolution in medicine. If you're as excited as I am about this breakthrough, hit that like button, subscribe for more science stories, and let me know in the comments, what medical advance do you hope to see next? Stay curious.